Hospitals across our country continue to deal with a critical shortage more than 3 weeks after Hurricane Helene. The storm affected operations at the nation's largest maker of IV fluids. KLTV7's April Peardont has more on how East Texas hospitals are working with others across the country to conserve the necessary IV fluids.
Baxter International's North Cove in North Carolina is one of the largest manufacturers of IV fluids in the United States. The damage from Hurricane Helene has diminished production levels at that facility.
We are on a call this morning with the chief medical officers across the country where we have facilities to talk about these same types of scenarios. The discussion today centered mostly around, are we doing anything different in any of our markets that we think is a novel way to help us conserve and a better way to help us understand what we can do to support one another?
Michael Lamentier, Chief Medical Officer for UT Health, says they are implementing conservation plans to avoid overstocking and waste.
There are things we can do to convert drugs from the IV form to the oral form where appropriate and able. There are sometimes things we do that are trickling in low amounts of IV fluids to keep a vein open with an IV in, where we could do another method like HEP locking that IV.
Although they have not yet been directly impacted, they are continuing to work with their vendor to secure full allotment in hopes of not having to adjust surgery schedules or cancel elective surgeries.
We have adequate inventory of IV fluids. The supply chain vendors that we work with that get us our fluids have provided us very good feedback regarding the allocations that we'll be getting, but we still think it's wise for us to be prudent to try to conserve fluids where able.
Lamentier says they don't anticipate any disruption in services at this time. April Peardont, KLTV 7 News.
And the White House has invoked the Wartime Powers of Defense Production Act to help speed recovery efforts across the country.